Hi.
Oh, can't hear me. There, is that
Yeah.
better? Let me
Awesome.
good.
Hi, everyone. Welcome to our Wednesday Wellness Coalition. My name is Ethan Childs. I'm a personal trainer. I'm going to go ahead and let each one of our panelists introduce ourselves before we get started. I'm going to start with Derek today. I'll let you go ahead and take it away, Derek.
Yeah, hi everybody. My name is Derek Thompson-Estia. I'm the owner of Life Changing Dinners, and we teach families how to eat healthy, lots of vegetables, and we show off some salad master.
Awesome. All right, I'm going to send it over to Kirsten Evenson.
Thanks, Ethan. My name is Kirsten Evenson. I'm with the Juice Plus and Tower Garden Company, and I am, like Derek and the rest of this crew here, committed to teaching people about wellness. Our theme for this month is how to have wellness on the go, because August is really kind of our moving and grooving and being out there on the go month. And sometimes that means more junk food. It can sometimes even mean less exercise, even though we should be out there moving our bodies more. So that's what this entire month is going to be about. So through my products, which are encapsulated whole food concentrates, no isolated fragmented vitamin. It's just salad bar in a capsule. You can take those with you on the go. And Tower Garden. So you can leave a Tower Garden for 2 weeks while you're on vacation and come home to fresh salads on your deck. So you'll be hearing more about that later in the month. But for now, I will turn it back to Ethan to have him share what he's got going on this summer.
Yeah, so my name again is Ethan Childs. I'm a personal trainer. The main things I'll be talking about is how you can stay active. It's a great time of year to do any sort of exercise on the go because the sun is out. It's never a bad time to work out in the sun, get some vitamin D while you're at it. And so I'll have lots of tips on ways you can do that among, just having fun and being active in the sun. All right, I'm going to send it over to Dr. Krisha Olson. Take it away.
Hi, everyone. Thank you, Ethan. So I'm Dr. Krisha Olson. I'm a naturopathic physician and licensed acupuncturist. I practice here in Northwest Portland, and I'm doing both in-office visits, specifically for those who like acupuncture or need acupuncture for their pain management, stress management, anxiety, you name it, acupuncture is going to help. And then telemedicine for all the naturopathic care. We are still very much in a pandemic, and so because of that, the talk I'm going to do today is all about how to travel safely during these really challenging times. Because even though, right, it's summer still and we're ramping up, more people are starting to travel. And how can we do that being aware of the circumstances? Because we can't just stay in home all 24/7, especially considering that now the CDC has finally recognized that low vitamin D levels is linked to increased COVID-19 risk. So that means we want to make sure that we have optimal vitamin D levels, and one way that you can do that is by making sure you're getting plenty of time in the sun, particularly during the hours of like 10 and like 2 p.m. where the sun is kind of at the highest point, so you'll get the most vitamin D levels. There is a great app that I really love if you want to keep track of your vitamin D levels. It's called Minder, and it just tracks based off of your skin how much skin is exposed, the angle of the sun, because that's actually one of the most important parts in terms of being able to synthesize vitamin D. And then how long are you in the sun, and it'll actually calculate how much IUs you're making, which I think is just amazing. All right, so with everything going on with where the virus is geographically, we want to know that those statistics. So one of the main things that I want you to, when you're thinking about traveling and where you're going to go, is it a hotspot? And if it is, then maybe not going there, going somewhere where there's lower cases so that you're not having as high you're having a lower likelihood of actually getting exposed to the virus. With that said, there's a lot more that goes into it. The most important thing is that safety is actually based off of your actions, not necessarily any particular location. So what that means then is you are going to make sure that you're doing your physical distancing. You're going to make sure that you're wearing your face mask if you're within 6 feet from someone else or you're just within an enclosed space. Of course, also pay attention to all of the local guidelines. So if wherever you're traveling to, their guidelines say that masks are mandated outside, then comply, because that is their rule, and being respectful is incredibly important because they have those rules in place. And the other thing is be outdoors as much as you can, right? So I already talked about the importance of vitamin D levels in that regard, but also when we think about the virus, or what we do know about the virus, is that there are lower likelihood or lower incidences of infection happening when it's outdoors. So if you are inside, there's a greater likelihood of that increased transmission. But outdoors, to date, there still hasn't been incidences in which there was a large outbreak from an outdoor activity. So what that means then is if you are able to stay away from being indoors as much as possible and doing activities that are outdoors, you're in much better shape. So that means camping, whether that's in a tent or an RV or other outdoor activities. And this also holds true for if you're staying local and you want to hang out with your friends, your family, do it outdoors because it's significantly safer. It doesn't eliminate the risk, but it greatly diminishes it. All right, so again, safety is in your actions. So make sure that you're doing your physical distancing at least 6 feet away from other people, being outdoors when you can be rather than inside, and then wearing your face mask, because yes, there is significant evidence still showing that that is incredibly beneficial. And in countries, there's actually a new study that came out that was looking at countries who implemented wearing face masks really quickly, and their numbers of the virus was significantly reduced the sooner that they did that. So wearing face masks is associated with decreased cases. One thing I do want to mention though about masks is that they are not all created equal. So the cloth masks are not meant to protect you. They protect other people from your droplets. If everyone is wearing a mask, then we're protecting everyone from each other, right? And so that's where the power is with the mask, is that it's universal if everyone's doing it. So that's with the cloth masks. There's no standard with them, so it can be a little bit tricky. The biggest thing with the cloth masks is that wash them frequently. So make sure that you're cleaning them and swapping them out, because if you're not, then you're having that increased contamination within the mask that then is really close to your face. And you can actually be infecting yourself with something else or the virus if you happen to have it on the surface. So you want to make sure that you're cleaning it. When you clean it, the cloth masks are going to be in the washing machine is perfectly fine. You want the hottest heat possible with detergent, because it's the heat and the soap that's going to be doing the trick. Then when you throw it in the dryer, again, high heat, because high heat is what's going to get rid of the virus that you have on your mask possibly. The other way you could do it is by adding, I actually do mine with a little bit of bleach, because I do at the same time that I wash my white coat. So you can always do that with your mask as well, to be extra diligent at making sure that you're killing all of the things. The other way that you can do that to clean your mask is by putting it in boiling it for a couple minutes in hot water, and that will do a similar trick. Okay, so that's cloth masks. The other two big masks that we're talking about are surgical masks, so the ones that we use as doctors, but they are getting more available. So with those, the surgical masks, again, they don't protect you per se, they actually still protect you, protect other people from you. It has a much better protection, meaning that actually a lot of your viral particles aren't getting out. So it's even stronger, more protective to other people compared to the cloth mask. So in terms of masks, it's going to be cloth mask is like the least effective, then the surgical, and then the most effective is going to be the N95. The N95 mask are the ones that are actually designed and known to protect you, the wearer, from the virus, because it filters out that. If it happens to have those valve outlets, then you're not actually protecting other people from you, you're just getting the protection yourself. And that's actually what I recommend for my really high risk patients. So like I actually told my parents, because my mother in particular is incredibly high risk with heart disease, pre-diabetes, and her older age. And so because of that, I tell her, she's also in Riverside where it's a hot spot. So I'm like, okay, you are only wearing the N95 mask because her protection is more important than her trying to protect other people at that point. So know the mask that you're wearing, and use what is going to be the best for you and your given circumstances. So again, the N95 masks, I do believe that they should be limited to those who are high risk and those who are actually in the front lines doing the treatment with COVID patients, because they're the ones who need a lot of protection because they have the highest risk in terms of that exposure. Generally speaking, a cloth mask will do just fine because you're limited to how much interaction you actually have within the indoor space or with other folks. Again, if you're just outdoors, you're in a much better shape and you don't really necessarily have to even be wearing a mask if you have that distancing in place. All right, and then let's talk about location. So if you're traveling, you also want to pay attention to where you're going. So I already mentioned, like if it's a hot spot, maybe deciding not to go there, or going somewhere else where the cases are lower in order to just decrease your overall exposure to the virus. And so you can find that on several different websites for how are different locations doing in terms of the virus. A great place to go is Johns Hopkins University. They have a very thorough amount of cases and the population. You can always go to your local health authority as well. So if you're in Oregon, the Oregon Health Authority has it all mapped out by counties as well. So that's a really great resource. Okay, and then if you can, camping or doing something in the great outdoors is going to give you the greatest protection against being with the virus, because you're just having that constant airflow, which is moving the virus out, and you don't have a contained space, which then again allows the particles to be less in the air than say inside. If you are not of the camping variety, that's fine. You can still go and do travel elsewhere. You just want to be mindful about where you're staying. So the next best place would be like a self-check-in Airbnb where you're limited to how much interaction other people have. You also want to make sure that beforehand, they're doing a very good job of cleaning and sanitizing, because with Airbnbs and hotels as well, they can have a lot of turnover, which then means you can have more people putting their cooties on stuff. So you want to make sure that everything's sanitized. And if you don't trust them, which I can understand, bring your own stuff so that you can clean it and have that peace of mind. So self-check-in Airbnbs are going to be your next best bet. The other option is, if you have to, is a hotel with air conditioners or the air that is circulated just within the room that you're in. So if it is centralized air throughout the entire hotel, you then now, even though you're just in your room, your air is contaminated by everyone else in that hotel. You don't want that. Right? Because then you just don't have as much control over what you're breathing in. And so you want to make sure that hotels are going to be like your last kind of option. And again, if you're doing that, you want to make sure that air is not being recirculated from other rooms, that it's just within the room that you're staying in. And even better if the hotels, the entrance actually opens up to the outdoors, because that's going to also decrease the amount of virus that could possibly be there. Okay, so say now you've gone to your place, you're traveled, you're there, you're in your nice little home. Now what? Make sure you bring your own food. That's what. So if you, especially if you're camping, because otherwise that just really sucks, and no one likes to be hungry when you're camping. I don't. So bring your own food. That's going to decrease the burden of having to use local resources, as well as possibly increasing your possibility of getting contaminated somewhere else, such as within their grocery stores or restaurants. And side note, if you are doing restaurants, eating outdoors is going to be much safer than eating inside. As you can tell, outdoors is kind of the key of this whole talk. It's like, if you can be outside, do that. Because that is, again, just the safest way, at least what the data shows right now. Okay, so bringing your own food and drink to minimize contact is a great idea as well. The other thing that I briefly mentioned was like, bring your own hand sanitizer, bring your own sanitizing wipes, and use them after touching public items, making sure that you're not touching your face. If you happen to be one, just really what am I trying to say? If you have difficulties with that, you can always use your sanitizing wipes to wipe down the surface before you use them, and then clean your hands again, hand sanitize them after the fact. Okay. And the other, other things that I just wanted to mention is really that the biggest thing or the most important thing is that safety is in your actions, not in any one location. So it really comes down to our individual responsibility to make sure that we're protecting other people by wearing our masks, by being outdoors, and following the rules that are within those set guidelines. And again, that can be really different compared based off of counties and individual cities and states. So just know where you're at. I know that in Oregon here, Bend is a very common place to go visit and vacation, and the city is really trying to limit the amount of visitors, because it is the visitors who are bringing the virus to Bend in particular. And so you just want to be mindful about if there are restrictions within the cities that they're at, or they're asking to limit travel. So just be mindful of those kind of situations as well. With that, I'll go ahead and open it up to questions, because that's kind of the biggest thing that I got for you today.
Hey, Dr. Olson, I just wanted to ask you what your opinion is. My husband and I are big backpackers, and so we go out into the wilderness, and it seems that the entire Portland metro area has the same idea. So the trails are really crowded this summer, and about half the people are masking up and the other half aren't. And, a part of me, every time I put my mask on, even when I'm outside, feels a little bit silly, but, it's hard on narrow trails to get 6 feet apart and away from each other. And I just wonder what you've seen study-wise. And I'm just kind of going that extra mile to protect myself and potentially protect others if I'm one of those silent carriers. But what's your thought on that as far as being masked out on the trail?
Yeah, so I know in Oregon, Kate Brown, our governor, has mandated that if you can't maintain that social distancing, even outside, to wear a mask. And so that is the guidelines, but I understand that it can be definitely challenging, especially if you're kind of taking it on and off. There have been studies showing that you need 2 things in order to actually get an infection. So you need the dose, an appropriate dose, and you need the time exposed to that dose. So what that then means is you need someone who is actively shedding the virus, and you need to have a significant amount of time with them. The likelihood that you're in an outdoor situation, the dose is going to be a lot lower, because it's just not going to be as concentrated of a dose because of all the rest of the air around you. And even better if there's a breeze. with that, the amount of time that it takes for someone to pass you is really fleeting. So you're getting a lower dose and a lower time exposed, the possibility of exposed. So the likelihood or your risk is relatively low. With that said, if you can, wear the mask, or if you see someone coming towards you, that's going to offer you even more protection to both of you.
Great, thank you. That's kind of what I thought. It feels like it's bringing the risk down to just hardly anything, but that's the whole point, right? we want the risk to be close to zero, and then we can all keep getting out there and playing and doing our thing.
Absolutely.
So, yeah.
The other thing I wanted to mention is that in Oregon, because so many more people are going outdoors and doing like the backcountry and the camping in general, we have seen a significant increase in wildfires. So if you're outdoors, please just make sure that if you are, doing your campfires, that they're completely out, because we're still having as we adjust to this new way of living, we also have to take in considerations of how it's impacting our environment and other ways that we can help to minimize the extent elsewhere, because the world is already chaotic and really fiery. We don't literally need fires also. So if we can just bring down all of that to being mindful of when we are outdoors, that would be super fantastic. Because again, if we burn down our forest, then where the heck are we going to go during this time? I have no idea. Other questions or comments from anyone here? Great question, by the way, Kirsten. It's so important, and that is the same actually reason why it's so important to be outdoors, because you decrease the dose that you're around someone, and then also the time. And then mask actually will help to give you a little bit, if both parties are wearing a mask, it gives you a little bit, reduces the dose so that theoretically you could then have a longer time together. But if I'm not saying to go out and outdoors and wear a mask and stay with each other forever without the social distancing, please still do the social distancing and all of that, because that's what's going to give you the safest way. It's just the safest currently as we know it, though the evidence always changes with us learning more and more about the virus, because it's brand new. So even though it's been around only for 6 months, it's still new and considering all the other viruses that we have had exposure to.
Dr. Olson, I have a question.
Yeah.
So I'm on the other side of Kirsten. I don't like to go outside. And Jared and I like to go to dinner with each other. And like we see other people there with their friends and all that stuff, like not a problem. But like we're like, oh my gosh, we would like to see our friends and go out to dinner. And we wear a mask like if people come in like to our office and all that stuff. So like we're fine wearing the mask, but then when we eat, it feels like I'm eating with them for like people would be eating with each other for about like 30 minutes without their mask on. And they're outside. What's your thoughts about that with going in?
Yeah, so with that, if they're not in your direct household, then maintaining the distance, the 6 feet, is going to give you the safest outcomes. And so doing that, so still, you can be outdoors, just be further away from those who are not in your direct household. If they're in your household, so like for you and Jeremy, you can definitely sit next to each other, but then have your friends on the other side a little bit further down, so that then you also don't have to be wearing your mask per se when you don't have to worry about that as you're eating, because absolutely it takes time to eat, and even better for you to take your time while you're eating, because we want you to digest your food. So don't be stressed out and eat really quickly, because then you're not doing yourself any favor. You're literally just putting in the food, but then you're not actually going to be absorbing all the nutrition from it, which, just happens to be kind of important for your overall health and your immune system. No big deal. And so maintaining that distance, being outdoors is incredibly important. And really it's those two things that are going to be your biggest protection, is outdoor space and keeping the distance away from each other. And then at that point, you're able to have some interaction, because we do need the community. We need the connection from other people, because we're pack animals. And if we don't have that connection as, for, you know, extended period of times, as we've already seen with lockdown, we get increased suicides and increase in depression, anxiety. So we want to try to figure out how can we manage our risk with what's going on with the virus while still maintaining a decent quality of life. So yes, you can definitely go outside with your friends, your family who aren't within your direct household, but right, maintain the physical distancing of at least 6 feet and being outdoors. If you're inside, it's much trickier to do that, especially if they have a airflow going through. They've done studies looking at outbreaks within restaurants, and those who were within the direct airflow of that circulation and were actually the ones who are at increased risk. So you want to be careful of being indoors. And so it's really like, for me, I won't do it inside. I'm like, I'm only going to eat outdoors because that is just so much safer. And for me as a healthcare practitioner, that's incredibly important, because I do see patients who are at higher risk, and I want to make sure that I'm not putting myself at higher risk on their behalf. So same thing for everyone else.
Yeah, and can I just add to that too, Derek? This summer I've been actually forced out of quarantine quite a bit because of, you know, family gatherings that needed to happen and whatnot. And you know, my husband and I really, we are very, very careful, and we just are very selective about who we go and socialize with. You know, all of what Krisha said is true. You know, we keep our distance, we stay outside, and we're super picky about other people that have been as careful as us. So that's been one of our criteria if we're going out and socializing. Just like, nope, if you haven't been careful, you're relegated to 20 feet away. You don't get to come
just
close
FaceTime
to
them,
us.
you know.
Just FaceTime those people. So yeah, so you just end up with your responsible tribe.
Yeah, that's exactly true. Great advice. I do recommend that with my more higher risk patients, that if you are interacting with people outside of your household, to make sure that they're also like doing a good job, making sure that they're maintaining their distance, they're decreasing their risk, because just being exposed to them, even if it's a little bit of time, increases your risk too if you're exposed to them, because that's how the virus works. This virus is highly, highly contagious. It does not take too incredibly much to catch it because of how it just sheds continuously and so early on without having symptoms. So that's really why the masks are really important, because it's you limiting how much possible viral particles you're expelling on the off chance that you do have it. And not everyone knows who has it, because again, not everyone's getting symptoms, or if you are getting symptoms, you won't actually get them until like 7 days from the time that you've been infected and actively shedding virus that whole time. And so that's all those people that you interacted with, if you weren't wearing a mask and doing your due diligence, that you could then also be spreading it to. And the name of the game right now is really decreasing that transmission as much as we possibly can, because it's gone crazy. We just have so many more cases nationwide, and we are trying to do our best, and it really comes down to individual responsibility.
I have one last question.
Yeah.
It's when you're getting vitamin D outside, do you have to, and you're also supplementing vitamin D, do you have to change your dose at all if you kind of know how much you're getting outside?
You definitely can. So I'll have patients who if I know their vitamin D levels, which I think is the most important thing, is actually getting that testing done to see where your levels are. Because if you're in the Pacific Northwest, your levels are likely low, or if you haven't been getting that exposure, even in a sunny area, you might not have enough vitamin D. So getting tested is going to be the most accurate way of figuring out where your levels are, which then can determine whether or not you need to be supplementing and getting plenty of exposure outside, or if you can just rely on maintaining your stores by getting sunshine. So it really depends on where someone's levels are. So before the virus, my recommendations have changed post-virus because of the correlation between increased risk and severity with low vitamin D levels. But prior to that, I only had my patients, as long as they were in good optimal levels, I only had them take vitamin D during the fall and the winter when we can't synthesize vitamin D because of the angle of the sun. And again, that's for here in the Pacific Northwest. And then in the spring and summer, when the angle of the sun is correct, we can make that vitamin D. And if we are, as long as we're getting plenty of exposure, then you can maintain your stores. The problem is that we were in quarantine for a couple months, and then also in Portland, we weren't getting much of sunshine at all during spring, so the supplementation was still very much warranted. It also depends on the dosing of someone's vitamin D supplementation. So if it's like 2000 IUs, doing that on top of like getting some sunshine, depending on how much you're getting, may be okay for some individuals, and then for others, doing a higher dose might be warranted, and getting vitamin D levels. It really depends on where your personal vitamin D is at.
Okay. Thank you.
Mm-hmm. Oh, the other thing with vitamin D is that it's fat soluble. So what that means is your body will store it. So you can actually take a large dose of vitamin D orally supplementation, and that will stay in your system. It's not like B vitamins where they're water soluble, where you can only absorb so much. So with that, like if you do get more vitamin D and you're getting the sunshine, that just might mean that you will need less supplementation further on. Later on, when you actually like get those labs retested, you can always see if you need to, maybe you don't need vitamin D supplementation at all anymore.
Perfect.
Yeah. All right, I think we've ran a little over because I just like to talk and ramble a little bit. So if there's no other questions, I think we'll go ahead and call it a morning. So funny.
Thanks so much,
And
Krisha.
yeah, absolutely.
Great information.
And Kirsten, are you going next week?
I'm next week, yeah. So I'm going to be talking about encapsulated produce and tower gardens on the go. It's like taking salads with you in capsules. It's so awesome.
Fantastic. We always need more vegetables and and all the vitamins and nutrients that are in it.
More than ever.
Yeah.
All right.
Yeah. All right. Thank you everyone for joining. Hopefully you can come again next week and learn from the amazing Kirsten. All right. With that, I'm going to end the meeting. So bye everyone.